Welcome to the Jigsaw session, Autism, Putting the Pieces Together, the Diagnosis and Communication. Communication is a skill which develops over time, and as with all skills, children will develop these at different times and will all have their own individual strengths and areas of difficulty. Some children may go on to be non-verbal or use very limited amounts of verbal communication, whereas other children may develop language to be able to communicate in spoken sentences and fluent speech. Unfortunately, there is no way of knowing how far a child will progress. However, what we can do is identify what communication your child is using, identify strategies to support your children to develop and to reach their communication potential. The strategies that will be covered in the presentation may not be appropriate for all children at their current developmental level. However, they may be of use later on in the future. Speech and language therapists can help with all aspects of communication and interaction, including skills such as understanding language, attention and listening, play, and developing the desire to communicate and interact with other people. These skills will all help your child's verbal and non-verbal language development. Not all children will be actively open to the core speech and language therapy team. For those who are not, we as neurodevelopmental speech and language therapists are able to give support and advice where needed. Who do we work with? Most importantly, we work with you as parents, as you are a very crucial part of your child's development. In the preschool years, most of the support process will involve us helping you to know how best to support your child on a daily basis. Home is often a good place for children to learn new skills as they feel most comfortable and the environment is not overwhelming. With support, children can then learn to transfer the skills they have learnt at home with you to other situations. Who else do we work with? We work with staff at your child's education setting if they attend one, such as a preschool, nursery or childminder. After you, its parents, preschool is often the place where children spend most of their time. Again, we can give advice and demonstrate strategies to help your child to get the most out of attending their preschool sessions. The complex communication team may also be involved in supporting your child at their educational setting. We also work with occupational therapists who are able to give advice and strategies to help with daily living tasks such as dressing, eating, sleeping and toileting, as well as strategies that will help your child's concentration and attention. They can also provide strategies to help your child to cope with information from their senses such as touch, sound and sight. Not all children will be known to this service. However, if you feel that your child would benefit from support from seeing an occupational therapist, then you can request a referral to be made from any professional, including your health visitor, GP, or professionals at your child's education setting. The Complex Communication Team are a team of specialist teachers and nursery nurses who specialise in working with children who have social communication difficulties or autism. Their role is to train and support your child's teachers to meet your child's needs. They run early years groups which your child may be invited to, and they also run early bird courses for parents whose child has received a diagnosis of autism. They work closely with other agencies or teams who are involved with you and your child to coordinate advice and targets. If your child is known to the core speech and language therapy team, then their targets may look similar to those from this team. Educational psychologists are specialists who can assess your child's learning ability and give advice to parents and teaching staff on any educational needs that your child may have. They can also give parents advice on the type of nurseries and schools that will be able to support your child's needs. Involvement from an educational psychologist is dependent on your child's level of need, and this is something that your child's education setting will discuss with you. This diagram demonstrates the support team around your child. It has your child at the very centre, with you as parents in the ring closest to them, as parent education is now regarded as a critical feature of early intervention programmes for children with autistic spectrum disorders. It then has your child's family and friends in the next ring as the next most influencing factor, then followed by education and finally professionals in the outer ring. Professionals have the least face-to-face contact with your child, which is why advice is given to those who are more familiar with them in order to have the most positive influence on them. Communication is a two-way process which involves not only being able to express a message to somebody else by talking, using gestures, facial expressions or symbols, but also being able to understand the message that is being communicated by another person. The understanding part of the process involves being able to understand vocabulary being shared by speech or pictures, as well as being able to recognise and understand the facial expressions and other non-verbal communication being shown by others. This slide shows the skills needed for effective communication to develop and the order that they typically develop in. At the bottom there is attention and listening, which enable your child to attend to a speaker and listen to what is being communicated to them. Then there is interaction skills, which include eye contact, turn taking needed for play as well as communication, joint attention, which involves sharing attention with another person and also having a desire to communicate with other people. Then there are oral skills, which involve the coordination of different muscles, including the tongue, needed to make sounds for speech, as well as the movements needed for eating and drinking. The coordination of muscles can be tricky for some children and can impact communication at many different levels. The next level up, following the development of these three areas, is the ability to understand spoken language, including specific vocabulary and grammatical concepts. On top of that, there is expressive language, which is when you are able to expressively communicate the items you now understand. Finally, at the top of the pyramid, there is speech, which is the ability to produce a vast variety of sounds needed to make up different words, and your knowledge of which words require which sounds. For example, the ability to make the sound needed to say sun, and also the ability to sequence sounds together to form words. It is important to say that these skills do not develop one at a time and will develop over many years. We often see children who appear to have very good expressive language skills, but when you look further, they are often the children who are good at learning and repeating phrases or sentences, but do not use them in the correct situations, meaning that they do not really understand the meaning of the words, or they may struggle to use language in a social way. For example, having a huge number of words to describe dinosaurs, but don't tell you when they want to drink. This slide shows the fundamentals of communication, written by Nind and Hewitt. These include enjoying being with another person, developing the ability to attend to that person, concentration and attention span, learning to do sequences of activity with a person, taking turns in exchanges of behaviour, sharing personal space, learning to regulate and control arousal levels. Using and understanding eye contact, using and understanding facial expressions, using and understanding other non-verbal communication, using and understanding physical contact, and vocalising and using vocalisations meaningfully, including spoken words. Autism is a spectrum, and every child will have different strengths, which can also vary depending on the situation that they are in. Your child may find using eye contact easier at home with you than when they are being spoken to by a stranger in a supermarket, for example. Joint attention is a form of social communication that involves two people sharing attention and focus on the same object or activity at the same time, as well as acknowledging the other person and their involvement in the activity. Research has shown that difficulties with joint attention are fundamental to autism and can have a significant impact on later language development. That is why early intervention in this area is so crucial. Intensive interaction is a way in which we can work with children to develop their basic play and interaction skills. These skills are the first important building blocks of early communication, as shown earlier in the slide with the green pyramid. The approach involves you copying what your child is doing with objects around them and imitating their sounds and vocalizations as a way of getting into their focus of play. The approach is useful for children who prefer to play alone or have restricted and repetitive play skills. There is a link on the slide to a video demonstrating how intensive interaction can help children with autism. There are also other emotional and learning outcomes that we would hope the children that we work with are able to achieve. These are knowing that others care and learning to care, enjoying being with others and connecting and bonding, attachment and attunement with others, self-security, to feel safe, secure and calm, identifying own feelings and seeing the same in others, gradually understanding feelings, trust, empathy, and right hemisphere brain development. Children learn best when they are feeling safe, secure, and calm, and when they are in this state, it enables them to access language much more easily. When children experience any extreme emotions such as anxiety, anger, or stress, their ability to process and access language decreases. Children with social communication difficulties or autism may present with a range of different difficulties associated with their understanding and use of language. Children may have a literal understanding of language and therefore find phrases such as butterflies in my tummy and it's raining cats and dogs confusing. They have difficulty understanding more abstract concepts such as time and emotions, which is why resources can be put into place to help make these concepts more concrete and easier to understand. Children may repeat language that they hear spoken around them, not fully understanding what it is that they're communicating. This is called echolalia. They may have preferred topics of conversations linked to their interests. They may repeatedly ask questions and often the same question. Children may also have an unusual intonation pattern. The next two slides contain useful information for those children who are not yet using much spoken language. Children with autism typically have a preference for learning language linked to numbers, letters, shapes, and colours. However, these topics are rarely functional and do not help children to express their wants or needs. The same goes for language linked to manners such as please and thank you. Alongside their preferred topics, it is useful for children to learn vocabulary which has more of a functional outcome. Words such as more, again, gone, look, go, and finished. These words can be generalised and used in a number of different situations. For example, the word more can be used to request more of a toy, an action, or an object, whereas the word yellow can only be used to describe the colour of an object. Your child is more likely to communicate about things that they are motivated by, such as foods they like to eat or toys they like to play with. If they are motivated by something, they're more likely to want to communicate with you about it. There are 3 key communication rules for supporting children to develop their communication skills. Reduce your language, provide opportunities for communication, and being visual. We will now look at these 3 strategies in more detail. Reducing your language. Children with attention and listening difficulties may miss parts of what we say when we communicate with them. Although they may be able to understand a full sentence, it is easier to follow an instruction if it is clear and simple. Therefore, it is important to give the main information words within an instruction rather than using long sentences with lots of other less useful words in. When talking about a plan for what is happening, children often pick up on the most important words. For example, if you say, "We're going to go to the park after we go to the shop," your child might expect to go to the park, then the shop. It is important that these are in the correct order, as words like before and after are not always the important ones, so try shop first, then the park. The instruction in red is a typical instruction given to a small child. However, the key information within the phrase is highlighted in green. This shorter phrase is clearer and will enable the child to understand exactly what it is they need to do without needing to process all of the other words within the original red phrase. So, "Lucy, stop running, you're going to hurt yourself," is another common instruction given to children. A key tip when giving instructions to children is to tell them what it is you want them to do, not what you don't want them to do. For example, "Lucy, stop," or "Lucy, walk." "Liam, can you go and find your shoes? It's time to go to Grandma's," can be shortened into two separate clearer instructions. Firstly, "Liam, shoes," and then once completed, and if needed, "Go to Grandma's," can be the second instruction. The second key strategy is to provide opportunities for your child to communicate with you. This can be done by offering choices wherever possible. For example, cereals or toast at breakfast, bubbles or bricks while playing, red socks or green socks whilst getting dressed. Another way of doing this is by changing the environment in a certain way. For example, moving your child's favourite toy to a different part of the room or to somewhere they cannot reach so that they have to ask you for it instead of helping themselves. You can also add pauses into your routines to create opportunities for communication. For example, pausing a game that your child is enjoying playing with you, such as bubbles, to encourage them to communicate that they want you to continue. Finally, you can create simple barriers which provide the opportunity for your child to ask for help. For example, giving them a snack that is unopened or the bubbles with the lid still on. The final strategy that we will look at is about being visual and showing your children what you are talking about using objects, pictures, gestures, and facial expression. Many children with social communication difficulties or autism learn mainly through things that they see and experience rather than things that they hear, such as language, but this is not true of all children with these difficulties. Showing children what you are saying helps them to understand what they are expected to do, helps them to feel safe and reduce anxiety, helps them to make sense of the world and follow a routine more independently, and helps them to learn what the words mean. Routines help children to learn. If the same thing happens each time, they will learn to associate that routine with the visual support you use and the words. It is important to be consistent when you are introducing visual support and use it each time that routine is going to happen. Objects, pictures and symbols remain even after the words have been spoken, so that your child can refer back to the visuals as often as needed, which helps them to understand more clearly and reduce anxiety. We all use visuals every day to help us with our daily routines, such as shopping lists, road signs, and written instructions such as recipes and clothing labels. Evidence has shown that using visuals supports a child's language development and does not have a negative impact on it. We can use lots of different things to make our communication more visual: natural gestures, facial expressions, hand signs, objects, pictures, photographs, and symbols. Here are some examples of visual supports that you can use with your child. There are many more available, these are just a few. There are sound timers for supporting children to learn how to wait and take turns, as well as learning time concepts. Now and next boards and visual timetables can be used to help children to understand routines and what they are expected to do, and they can be great at helping children to be more independent. Emotion keyrings can be a way to help teach emotions, which are very abstract concepts, can help children to express how they're feeling to others. Makaton is a formal system of hand signs, symbols, and speech used for communication. There is a large vocabulary of signs and symbols available, which include core vocabulary and more specific topic-based vocabulary. Makaton helps children to understand what you are saying, as well as communicate themselves, which will ease their frustration if they're not able to use words yet. There are courses available to help you to learn this formalised system, and you can find out what is available in your area by following the link. The Picture Exchange Communication System, known as PECS, is a specific way of teaching your child to initiate a request for something that they want. It uses symbols or photographs, but these are always accompanied by the spoken word. Although the primary purpose of PECS is to teach communication, it often also results in increased spoken language. If your child is known to the core speech and language therapy team, then your speech and language therapist will be able to advise you as to whether they think this method is suitable for your child and will also help you with implementing it. Social stories are short descriptions of a particular situation, event, or activity, which include specific information about what to expect in that situation and why. They help children to understand their social world and behave appropriately within it. They are written for each individual and tailored specifically to the child. They can be collected into a book of stories as a resource for the child to refer to over time. The website on the slide has more information on what social stories are and how to use them, as well as some example stories for you to take a look at. As parents, you may try some different strategies and find that some will work better than others. Things do not always work the first time, so it's important to persevere. If you're known to the core speech and language therapy team and need some additional help or advice, then you can contact them. If you're not known to them, you can contact the speech and language therapists within the Neurodevelopmental team for advice. Please call the service if you would like to speak to a member of the team. We also have a website with useful information and links to other support. The Dimensions tool can help to direct you to support based on your child's level of need.